Hello, my name is Mrinalini Dey, and I am reporting from EULAR 2025 in Barcelona for Room Now. I'm a rheumatology fellow working in London. Today, I am delighted to be joined by Zoe and Jeanette from Lupus Europe. I'm very excited about this video because it's something that I'm very passionate about, and of course, my two guests are extremely passionate about what we're going to be talking about. So, for the clinicians in the audience, when was the last time your patient asked you, where can I find more information about a given disease? Or when was the last time they told you they've asked Dr. Google? And for any patients that are watching, when was the last time you asked Dr. Google? And did you trust what Dr. Google told you? Have you even asked Chat GPT lately? So, Lupus Europe have developed an innovative tool that actually won an award at EULAR 2025 this year and was actually teased to us in its first form last year. So what I'm going to do is I'm just going to hand over to our guests to tell us more about Lupus GPT. So Zoe or Jeanette, would you like to give us a brief introduction?
Yeah, sure. I can start. So as you just said, people get told by the rheumatologist, don't go home and Google, don't go home and look on AI, but people do it anyway. And it is a great tool. It can help us in many ways, but we also know that there's so much misinformation out there. So these tools don't differentiate between good quality information and bad quality information. So we wanted to solve that. And we thought, okay, we were in a fishbowl in the European Lupus meeting in 2024, where the theme was actually a bunch of researchers have found out that patients actually found ChatGPT to be more empathetic than GPs when they looked at their answers. And we thought, oh, because this means that people are going to now ask ChatGPT instead of asking physicians. We really don't want them to do that. So we thought, okay, let's take all the good quality information, put it into a tool, and make sure that it doesn't go outside this tool. And people, if they look for an answer and it doesn't have the answer yet, it will just say, I don't have the answer. It won't ghost. It won't go anywhere else looking for an answer. So that was the initial goal, to sort of find a way to make this tool. And then, Zoe, you started looking at how that was possible.
Yes, you're right. So we were very excited about this idea and how we could develop this and what we could do. We're not AI experts, I have to say, but we are passionate and we're dedicated, and we were really committed to trying our best. So first, we created a beta version in a closed large language model, really, and that used a restricted database. So like Jeanette said, one of the important things was to restrict the database so that it couldn't go outside this locked room that we create. So this was not easy, I have to say, to do. And one of its challenges was how to stop it from reverting back to its training data, which AI always wants to do. AI will always try to go outside the database and will always try to revert back to training data. It was very, very important that it didn't do that, and that it was only restricted to this database. Because we have a number of industry partners, we had discussions with their in-house AI experts, really, who they were able to give us some tips. And we also connected with AI developers in this, but really the beta form of this tool we did. And then we also connected with doctors, and I have to say, all of the things that we do, and Jeanette, you can perhaps speak to this a lot more, but it's important for us to connect with doctors and do things with doctors. So
Yeah,
just
so
to
whenever
throw
we
that out.
whenever we do something, we want to make sure it's always backed up by evidence and by science. And we do that by working with our own medical board. And they're really wonderful. So they're quick and they always come back and they are so willing to help us. So when we say, for instance, we have a question here, we need an answer, can you help us? People are really fast and we're eager to put their hands up and say, yes, of course, we will help you with anything you need. We make sure that other patients have also looked at the materials before it's put into this database, because we want to make sure it's understandable by patients, but it is actual good information, valid information from a doctor's perspective as well. Which, of course, after Zoe sort of did this thing with her small tool, we actually were able, as you said, Mini, to then have a beta version available at last year's EULA, which was on the 12th of June. So we come from the 21st of March to the 12th of June. We had a tool. That was incredible, and we were amazed ourselves.
Yeah,
Indeed.
I do remember being very impressed at last year's EULAR, and then this year, of course, you've not just got Lupus GPT, you've got the easy Lupus GPT as well. So I've actually tried both versions, and I have asked it several questions, and I am very impressed. It gives a very not too long an answer, so you don't get bored. You don't feel like it's speaking at you. It's sort of working with you to get the answer that you want. And it's really great because I personally have been speaking a lot about health literacy during this Congress. We've heard a lot about that. We've heard a lot about social determinants of health. I know Lupus Europe was involved with some work on social determinants of health and lupus. And we've heard a lot about AI. And so this kind of marries all of that. It really addresses and makes sure that people get the information in a format they want. And I know me and Zoe were having this conversation at EULAR, but it really helps to address the questions which people may not want to ask their doctor. There may be a bit of a taboo. They may be embarrassed to ask. They may feel like they're stupid asking, but no question is a stupid question. And it comes back to what Jeanette was saying. They feel like they're getting empathy from the GPT model, which is actually tells us that maybe clinicians have a bit of work to do there as well.
That's a different discussion.
It's a different discussion, absolutely. So just maybe if one of you wants to tell me a bit about, we've talked about the difference between, so I didn't tell you the difference between Lupus GPT and Easy Lupus GPT. So maybe if one of you wants to just give us a couple of sentences about that briefly.
Go ahead, sorry.
Yes, so I can do that more than happily, really. So when we created Lupus GPT, one of the thoughts that we had was that we have so many wonderful resources that are tailored really to patients. They're in patient-friendly language, and a lot of patients can access them. However, if you're a patient who struggles with brain fog, and a lot of lupus patients do struggle with brain fog, quite severe brain fog sometimes, or if you're a patient who just has lower literacy levels or lower health literacy levels, even information that is tailored to patients is not accessible to you. And we really wanted to do something to include more people really in valid information. So that's how the idea of Easy Lupus came about. And Easy Lupus is something we're also very, very proud of. It is a tool that is based off of the exact same library of documents as Lupus GPT is. So equally valid in terms of information, but it condenses the information when it gives it back to the user, and it simplifies the information severely, really, so that it's understandable by a broader audience. So if you hate medical jargon, medical speak, that's the tool for you, really. So, and I have to say, we said this a little bit, but it can't be emphasized enough. Both tools are multilingual and they speak almost any language. And Jeanette, perhaps you can say a bit more about that.
So we've, of course, reached out to all of our patient organization pals around the world and asked them to test the tool. So everyone we've asked, when they've prompted the tool a couple of times, it speaks their language. So we know for a fact it actually speaks African Zulu, it speaks Korean, it speaks all kinds of different Indian dialects, many languages which normal AI tools actually don't speak, which also was a huge surprise. And actually the developers don't even know how come it speaks so many languages, but it's a good thing that it does. It just means that more patients can access the information.
Fantastic.
Absolutely. And just to jump on this, sorry, very quickly, and to say that when the tool was deployed in beta version, we asked doctors and attendants at EULAR 2024 to test it in multiple language, because that was very, very, really crucial for us. We asked patient organizations across Europe to test it in their language. We got the members of the Patient Advisory Network from Lupus Europe involved to test it in their language, our medical advisory board to test it in their language. This has been tested in multiple languages in terms of not just the content it's got on the back end, but the content it will give the user. But obviously we can't test it in African Zulu. So it's wonderful to hear from people that it works in those languages as well. Yeah.
Absolutely. So in just the final few minutes, what's next?
I'm so glad you asked, because now we have Easy Lupus, and it's really great that we have access of information to these people. But what about if you are completely illiterate? What about if you don't read and write? What about if you're blind, or if you have severe arthritis in your hands and you have difficulties typing? So we thought, what's the next step? Well, the next step is having a spoken version of this AI tool, which we now have in a beta version. So it's on the Easy Lupus tool. We've connected it with this spoken version, where you can actually scan a QR code with your phone, ask your question in your own language, and it will read out the answer to you in your own language as well. So it's still in the beta version, so we're still testing it, but we have high hopes that it will become at least as popular as the other two.
Fantastic. Right. Well, I think we could carry this conversation on all day, but we sadly have to wrap it up there. Thank you so much, Jeanette and Zoe, for joining us today on Room Now, and for everyone at Lupus Europe for developing this tool. It's going to be very helpful, and certainly I'm going to be letting my patients know about it. If you'd like to know more about what's going on at EULAR 2025, you can find all of the coverage on the Room Now website. Thank you for joining us.